everyone. Thank you all so much for having us here today. My name is Madeline, and this is Katie, and we are two senior members of the Opiate Outreach Bass Connections team. We're so excited to be here and share with you some of our accomplishments that we've been able to see over the past couple of years. Before we do that, I first want to start by explaining a little bit about what the opiate epidemic looks like here in North Carolina. As you can see on this graph, from 1999, the use of opiates has increased steadily in the state. And in more recent years, there's been a spike in heroin and synthetic opioid use. So Katie and I and the rest of our team members came to this project with various personal connections to the opioid epidemic, but we all needed to do a better job of situating ourselves in the context of the state of North Carolina specifically. So we spent our first summer together in the beginning of our project really learning about what is being done in the state of North Carolina to address this issue. And we met with a wide variety of stakeholders, including treatment providers, law enforcement officers, and other policymakers to see what's being done already to address this issue. We wanted to ask ourselves, how could our team do the most good, and where do we fit in this wide network of stakeholders?
So our team came up with dozens of ideas initially, but we only we only took action on a few of these ideas that we knew could have the most impact. Today, our presentation will take you through 4 of the impacts that our team has had over the past 2 years on Duke, Durham, and North Carolina. So we knew that the opiate epidemic had been growing since 1999, but we wanted to look more specifically at the trends towards heroin in recent years. We partnered with statistician Bryce Bartlett to analyze publicly available data on heroin mortality by county in our state. We learned that counties in North Carolina can be divided into 5 categories. There's counties that showed an early and rapid rise in heroin deaths, while other counties appeared virtually untouched by the epidemic entirely, with most counties falling somewhere in between. Furthermore, we observed that heroin mortality is currently shifting from rural counties to urban counties. This research, which will be published in the North Carolina Medical Journal this May, can be used to inform future research and policy interventions. So, as everyone in this room knows, research can be a long process. So our team wanted to develop some more short-term ideas that we could have an immediate impact. We partnered with the North Carolina Harm Reduction Coalition, a grassroots organization dedicating to advocating for and protecting people who are affected by drug addiction. We packaged naloxone rescue kits with them, which contain the drug naloxone, a life-saving drug that is used to reverse an opioid overdose. The Harm Reduction Coalition is also very active in policymaking, and during our first kit-making day, we helped them lobby the North Carolina State Legislature and were successful in legalizing syringe exchange here in our state. Another important aspect of advocacy is reducing stigma, and the best way to reduce stigma is through education. We partnered with Alliance Behavioral Healthcare here in Durham to provide free mental health first aid training to undergraduates, medical students, and nursing students here on our campus. Through this intensive 8-hour training, we now have over 100 members of our campus community who are certified to respond to a mental health emergency.
One of our most important community partners has been the Durham Crisis Intervention Team, a group of first responders and law enforcement officials specifically trained to recognize and interact with individuals who are experiencing a mental health crisis. We wanted to share this team's amazing work with the Duke community, so we organized a panel discussion seen here in the slide and psychiatry grand rounds presentation to inform the rest of the community about this team. We also wanted to help the CIT team interpret and analyze their data in order to have the increase and optimize their practices. So this turned into a Data Plus summer research program hosted by the Social Sciences Research Institute here at Duke. Another important community partner has been the Duke University Hospital Emergency Department. In 2016, over 1,600 patients were seen in the emergency department who met the criteria for a high risk of opioid overdose. Only 14 of these patients left the emergency department with a prescription for naloxone. which is less than 1% of patients. Every patient who is at high risk of an opioid overdose should have access to this life-saving drug. And our team wanted to intervene to tighten this gap and address this disparity. So we got together and created patient and provider education materials to increase prescribing practices of naloxone, as well as a new Duke electronic health records process to meet this goal. And we're so excited to say that Dr. Mary Funk, who is a resident in the Duke Emergency Department, is going to be taking over this project next year and making sure that it actually gets implemented. And we could not have been able to accomplish any of these wonderful success stories without the support of Bass Connections, our team leaders, both years of our team, and our amazing community partners who are listed here. Thank you so much.